Hello guys, this is Avinash and you are watching Dr. Dental Smile Changes the Mood. So guys, in this video we are going to discuss about mandible, and you all know that this is a very important practical based question which generally comes in all the university exams as well as in the internal exams, and it is the most important question for the BDS students, or we can say that for it is very much important for the dental students. So guys, watch this video till last and don't forget to like, share and subscribe the channel, and also click on the bell icon to get the notifications fast. So basically, if you will see, in human beings there are two jaws, that is, one is the upper jaw and other is the lower jaw. So the upper jaw is known as the maxilla and the lower jaw is known as the mandible, and today we are going to discuss about the mandible only. And in this video, first we will cover the introduction part and then we will go to the body. In the body we will be discussing the outer surface and the inner surface. Then we will be discussing about the muscles that are attached in this mandible, and also we will cover the nerve, blood supply and the arterial supplies. So if you will, first we will see the introduction part. So this mandible, if you will see, it is also known as the lower jaw, and this is the largest and the strongest bone which is found in the face region. And if you will see the development, then it is developed from the first pharyngeal arch, and you can see that this is a horseshoe shaped structure, and in this horseshoe shaped structure we can see that the teeth are lodged in this alveolar process or the alveolar bone, and there is a pair of rami, means here we will find one rami and here is also the rami, and this rami is projected upward from the posterior end of the body, and in here in the rami there is the attachment of the muscles of mastication. So now we are going to discuss the body of the mandible, and in the body we will see that there are two surfaces, and this one is the outer surface and this is the inner surface. So two surfaces are there, that is the outer surface and the inner surface. So first we will discuss the outer surface. So in the outer surface, the first thing that we will see is the symphysis menti. So here we can observe the symphysis menti. This one is the symphysis menti, and it is a line which joins the right and the left half of the bone with each other. So this is the symphysis menti. Just below to the symphysis menti there is the mental protuberance. So there is a mental protuberance. So this mental protuberance is the median triangular projecting area. It is the median triangular projecting area, you can see here clearly, and this forms the mental protuberance which is present just below the symphysis menti, and the at the inferolateral angles of this mental protuberance, at the inferolateral means inferiorly and laterally, there are present the angle forms a tubercle, and this tubercle is known as the mental tubercle. So these are the mental tubercle. So here and here there are mental tubercle. So after mental tubercle we will observe that there are two foramens here. So here is one foramen and here is also one foramen. So these two foramen are known as mental foramen. So these are the mental foramen, and these are present in between the intervals of the premolar teeth. So here you can see the premolar teeth, and in between their intervals, here is in between their interval you can see the mental foramen. So these are the mental foramen. So after mental foramen we can clearly here observe the oblique line. So this one is the oblique line. This oblique line, if you will see, then it is the continuation of the sharp anterior border, means here we are saying that this is the ramus of the mandible. So it is the continuous sharp border, and it is the continuous sharp border of the ramus of the mandible which is running forward and in the downward direction towards the mental tubercle. So it is running downward and forward towards the mental tubercle. So this is known as the oblique line. So after oblique line then comes the incisive fossa. So basically incisive fossa is present here, but it is not clearly demarcated in this region. So this incisive fossa is the depression that lies just below the incisor teeth. So you are observing that these two are the central incisor and these two are the lateral incisor. So just below to the incisor teeth we will find the incisive fossa right over here. So this is in the outer surface. Generally we will find all these important structures in the mandible, and this is the ramus of the mandible, and this is the coronoid process, and this is the condylar process, and this is the angle of the mandible. So this is the angle of the mandible, this is the coronoid process, this is the condylar process, this is the oblique line, and here we said that it is the symphysis menti which is joining both the right and the left half of the bone with each other. Below to it there is mental prominence or mental protuberance, and just in the inferolateral angle there is the presence of the mental tubercle, and two foramens are present, that is the mental foramens. These are the mental foramens which is present just in between the interval of the premolar teeth, and here below the incisive fossa, below the incisor teeth, there is the incisive fossa is present. So now we are going to discuss the inner surface of this body, and in inner surface the first thing that we are going to discuss is the mylohyoid line. So here you can see the mylohyoid line is present, and this mylohyoid line is the prominent ridge which is running. It is a prominent ridge and it is running also in the downward and in the forward direction, and it is just started below the molar teeth, just started below the molar teeth, and it ends at the median area below the genial tubercle. So this is the mylohyoid line. It is a prominent ridge and it starts at the molar teeth, below the molar teeth, and is running in the downward and the forward direction again to the median area just below the genial tubercles. Actually here the genial tubercles are clearly not visible as it is not the original bone, so it is not clearly visible here. And if you will see mylohyoid line, to below the mylohyoid line there is a fossa, and above the mylohyoid line there is also a fossa. So in the fossa which is present just below the mylohyoid line is known as the submandibular fossa, and here in this submandibular fossa region the submandibular gland is present, and to above the mylohyoid line if you will see there is also a fossa that is known as the sublingual fossa, and this here, and in the sublingual fossa if you will see there is the sublingual gland is present. So sublingual gland is present in the sublingual fossa, and the posterior surface of the symphysis menti, this is the posterior surface of symphysis menti. See here is the, in the outer surface we said that this is the symphysis menti, so this is the anterior surface and this one is the posterior surface. So in the posterior surface of the symphysis menti we will observe that there will be four small elevations will be present. So in these four small elevations are known as the superior and the inferior genial tubercles. Though these are not clearly demarcated in this bone as it is not the original bone, but still we will find in the posterior surface of the symphysis menti four small elevations known as the genial tubercles, and these four elevations are known as the, that is, two superior genial tubercles and two inferior genial tubercles are present. You can see the mandibular foramen, this one is the mandibular foramen, and here you can also see the mandibular foramen here. So near to mandibular foramen means in this region there is the attachment of the spinomandibular ligament, and here there is the mylohyoid groove. So mylohyoid groove is here present. It is present in the ramus of the mandible and extends to the body below the posterior end of the mylohyoid line. So it is extend below the mylohyoid line, that is the posterior body, posterior end of the mylohyoid line. So these are the bony structures, and here similarly we can find the coronoid process and the condylar process. These are the coronoid and the condylar process, and here you can clearly see the head and the neck region of the, this is the head part and this is the neck part of the condylar process. So these, all these are the bony structures that we are going to find in the mandible. So if you will see again, in the outer surface we are going to find the symphysis menti. This one is the mental protuberance, and to mental protuberance there is the mental tubercle. These are the mental foramen, these are the mental foramen here present, and this is the oblique line, this is the ramus of the mandible, and here is the angle of the mandible, and here one thing we left, that is the digastric fossa. So this is the digastric fossa. You can see here there is a depression, this is the digastric fossa, and here another thing is present, that is the incisive fossa. And in the inner structure, in the internal surface, we will be finding the genial tubercles, that is 2 superior genial tubercle and 2 inferior genial tubercle, and this one is the mylohyoid line. Below to the mylohyoid there is submandibular fossa for the submandibular gland, and above to the mylohyoid line, that is the sublingual fossa for the sublingual gland. And here we can see the mandibular foramen, and near to the mandibular foramen there is the attachment of the spinomandibular ligament, and there also there is a mylohyoid group which is not clearly visible in this region, and it is present just below the posterior end of the mylohyoid line. It is present just below the posterior end of the mylohyoid line, and this is the coronoid process, and this is the condylar process, and this is the head of the condylar process, and this is the neck of the condylar process. So in this video we discussed about all the bony structures that usually we get in the mandible, and in the next video we will be discussing about the muscles attachment and in the about the nerve supply, venous drainage and the arterial supply. So guys, I hope you learned something from this video. So don't forget to like, share and subscribe the channel, and also click on the bell icon to get the notifications first.